Hello, my name is Dr. Marilyn Reimer. I'm a neurologist and medical director for St. Luke's Neuroscience Institute. For the purposes of this video, I'm taking the part of a primary care physician. I've been taking care of patients with Alzheimer's disease and mild cognitive impairment for the past 30 years. Although we do not yet have a cure, we do have some tools to slow the progression of the disease and possibly prevent mild cognitive impairment, known as MCI, from transitioning to Alzheimer's disease. Early detection of cognitive decline allows us to get a head start with these prevention strategies, and the best time and place for that to happen is in your office at the time of an annual physical exam. I think you're going to find this program describing a practical and validated approach to cognitive screening in the primary care office to be very interesting. You will see that the test is self-administered and can be done while the patient is waiting in the examination room. Your discussion of the test results could come at any time during the patient visit, and the discussion of the subsequent steps in the case of an abnormal test should not be time-consuming for you.
Alrighty, Mr. Wolf, if you'll follow me down this way, we're going to go right into a room and do your vital signs.
Okay.
How are you doing today?
Excellent.
Very good. That's good to hear. If you'll have a seat right here in this middle chair for me, and I'm going to get your blood pressure for Dr. Reimer.
All right. Hope it's normal.
Yes, let's see. This will take just a couple seconds.
Okay.
All right, blood pressure looks great.
Good.
Now with your annual exam for Dr. Reimer,
Okay.
we are also doing a memory exam.
Okay.
Is that something you'd be okay participating in?
Sure.
Wonderful. If you can sit here and start filling this out for me.
You want
and
the top part filled out, or you want just the bottom?
you'll want to fill all 4 pages out for me.
All 4 pages.
Dr. Reimer will be in here with you shortly, okay?
All right, Julie.
Thank you very much.
Hi,
Hi, how are you?
I'm doing fine. Well, I wanted to go over the results of the memory test that we asked you to do, and thank you for doing that. It's sort of a new part of our annual physical exam. You were having some trouble with some of those questions, and I'm sure you're aware of that. So we need to figure out why that is. And what I would recommend is the good diet and exercise that we've already talked about, but also a consultation with a neurologist who specializes in this kind of thing. And he or she will figure out maybe what's going on and what we could do about it. And then I'll see you back and we'll decide on the plan.
Sounds good.
Does that sound okay? Okay, thanks very much.
Thanks very much for taking care of me.
You're welcome.
Hi.
Hi.
How are you today?
I'm doing fine, and I'm really glad to tell you that you are doing fine.
That's
Your
great.
physical exam was great, and your memory testing was really good.
Good.
That's something we're going to include on every annual exam now because we think it's really important.
That's a relief.
So, yeah, I'm sure it is. But you're off the hook for another year, and just stick with your exercise program and your good diet, and I'll see you back in a year.
Thanks for supporting me.
You are welcome.
Take care.
Bye-bye.
Why should we do memory testing? A combined working group from the National Institute on Aging and the Alzheimer's Association of America have identified new criteria for the clinical diagnosis of mild cognitive impairment due to Alzheimer's disease. These include a change in cognitive functioning reported by the patient or family, lower performance on testing in one or more cognitive domains greater than would be expected for the patient's age and educational background. These are areas such as memory, orientation, attention, recall, or language. A reported or documented decline in episodic memory, which is the recall of people, events, or places. Decreased efficiency or accuracy in performing more complex tasks of daily living, such as paying bills or shopping? Or any of these features above, which occur with no accompanying difficulty with basic, everyday activities. The St. Luke's Neuroscience Institute recommends using a screening tool like the SAGE for several reasons. Recent changes in the copyright enforcement of a widely used cognitive screen, the Mini Mental Status Exam, or MMSE, have made it impractical because of cost. The SAGE has 95% specificity and 75% sensitivity, both better than the MMSE. The SAGE is easy to administer and score, taking typically less than 5 minutes of staff time. And it is available free of charge. Getting started with the SAGE is easy. The screening tool comes in 4 different forms to minimize learning effects. These can all be downloaded freely from the website, as well as the scoring standards and instructions. Administration of the SAGE is also simple. The patient completes the assessment on his or her own without direction or help. You can give general encouragement, but shouldn't offer specific help on any item. A general instruction to the effect of, fill out this questionnaire on your memory and do the best you can, should suffice. Having the patient complete it alone in the exam room is the ideal location. If the patient is with a caregiver, those accompanying the patient should be reminded to refrain from helping the patient complete the form. 10 to 15 minutes is ample time to complete the screen. If, after 15 minutes, the patient is not able to finish, that is a fairly good indication that they should probably be referred for a face-to-face screen at the Brain Fitness Center, a free service we offer to St. Luke's Health System patients. The scoring for the SAGE is quick and relatively easy. As with any screening tool, if you have a question about whether an item is right or wrong, a rule of thumb to remember is that it's probably wrong, because you're not automatically registering it as accurate. You can use this bias to guide you as you glance through the answer sheet. An easy way to familiarize you with scoring is to present an actual answer sheet with the correct responses, and then contrast this with responses which would not be judged as accurate. I'll run through each response item, then talk about general scoring guidelines. This is the first page of the SAGE. At the top is biographical information and medical history questions about memory, balance, and other issues. These items are not scored, but may provide insight into the respondent's presenting symptoms or a basis for discussion of these topics if necessary. The first numbered item asks for today's date and gets up to 4 points, 1 point each for month, date, and year, with an extra point if the date is exactly right, 1 less point if the date is off, up to 3 days. Item number 2 is picture naming. In order to eliminate educational effects as much as possible, accept any spelling which represents an approximation of the target word for a total of 2 points. This example would earn 2 points. And here is an example of one that would earn no points. This is the next page of the screen. Item number 3 is similarities. The patient is asked to identify a common characteristic of 2 related items. If the patient correctly names the abstract category, measurement, 2 points are awarded. 1 point is given for a more concrete commonality, like they have numbers. Items 4 and 5 are math questions, 1 point each for the correct answers. Item 6 asks the patient to retain and recall an instruction to be performed at the end of the screen, writing "I am done" on the last page. Item 7 asks the patient to reproduce an angled box representing a 3-dimensional figure for 2 points. 1 point if the lines are accurately placed but are off by more than 10 degrees. This is an example of a successful reproduction. And here is an example of an unsuccessful one. Notice the multiple attempts and lack of perspective. If the patient is able to self-correct to an acceptable drawing, score 2 points. Item 8, clock drawing, is a classic executive functioning measuring task found in many cognitive tests. The patient can score either 2, 1, or no points. Look at the 4 major features of the clock: a circular face, 12 numbers, correct hand position, and correct hand size. If all 4 of these features are correct, score 2. If 3 or 4 are the correct, score 1. All else, score 0. The clock here scores 2 points. Now look at this clock, scoring 1 point. And now this clock, which earned no points. This is the 3rd page of the screen. Item 9, word fluency, asks the patient to list 12 different items by category. Depending on which form of the screen you're using, it may be animals, fruits, or countries. Again, to eliminate educational effects as much as possible, any spelling which approximates a correct answer is acceptable. Score 2 points for 12 correct items, 1 point for 10 or 11, and no points for 9 items or less. Item 10 is trail making, another frequently used test item for cognitive assessment. The patient is given an example and then is asked to draw a trail, correctly connecting the circles, alternating back and forth between numbers and letters of the alphabet. Score 2 points for an accurate trail, 1 point for 1 or 2 errors like this, and no points for more than 2 errors like this. This is the last page of the screen. Item 11 is a visual spatial construction task. It requires the patient to alter the appearance of a geometric figure so that it becomes a different geometric figure. Although the printed instructions are a bit complicated, scoring the result is easy. This is an example of an accurate response, which receives 2 points. 1 point is given if either the lines are marked out correctly or the final diagram is correct, like this. The final item is the recall of the direction in item 6 to write "I am finished" in the space provided. 2 points are scored for a correct answer, 1 point if what they write contains either the words "finished" or "done," like the response here. Here is the scoring sheet. It can be used to quickly sum the test items for computing the total. These are the scoring standards for the SAGE. You can see that the magic number is 17, and that anything below that should constitute a referral. Since most items are 2 points, an easy rule to remember is that if they miss more than 3 items, it's probably an automatic refer. Some important points to remember about the SAGE. 1. It's easily downloaded from the website sagetest.osu.edu. 2. It has better sensitivity and specificity than the MMSE. 3. It takes less staff time to administer and score, usually less than 5 minutes. 4. The test comes in 4 different forms, so learning effects are minimized. 5. And, unlike the MMSE, it's free. Best practice for Alzheimer's screening in primary care involves early detection for the timely use of currently approved medications for symptomatic treatment. Less than 50% of those with Alzheimer's disease are currently diagnosed. Much of the American public believes that memory loss is a normal part of aging, or that Alzheimer's is untreatable. Use of a valid screening tool like the SAGE can help primary care practitioners achieve more successful best practice.
Hello, my name is Dr. Peter Holt. I practice internal medicine and geriatrics. As a geriatrician, it is not uncommon for an older adult to present to my office with a complaint of cognitive or intellectual or memory impairment. When this is the complaint, I will often have the opportunity to do some type of a cognitive assessment or screening in the office. While there are many tests available that are simple and easy to use in the office, one of the more successful ones is called SAGE, or the Self-Administered Gerocognitive Examination. When a patient takes this examination in the office and does show evidence of cognitive impairment, There are then several options for approaching that particular problem. Oftentimes, a neurological consultation can be helpful to look for different reasons for cognitive impairment. One of the other opportunities that we have at St. Luke's is the Brain Fitness Program. We can refer patients to the Brain Fitness Program where they can receive additional testing and more thorough testing of their cognitive function, while at the same time they have the opportunity to learn methods and mechanisms that they can do to improve their cognitive function.